This infographic explains the clinical pharmacology of antianginal drugs step by step, moving from disease mechanism, types of angina, drug classes, mechanisms, clinical cautions. Here is a clear explanation of each section of the image. Number 1, pathophysiology of angina, top left. Oxygen supply versus oxygen demand. The heart requires a continuous oxygen supply to produce energy for contraction. Angina occurs when myocardial oxygen demand, oxygen supply, factors affecting oxygen supply, coronary blood flow, coronary artery patency, atherosclerosis reduces it, oxygen content of blood. Factors increasing oxygen demand, heart rate, myocardial contractility, afterload, blood pressure, venous return. When supply cannot meet demand, myocardial ischemia, chest pain, angina. Number 2, types of angina. A, stable angina, classic angina, cause fixed coronary artery stenosis 75% due to atherosclerosis. Characteristics, predictable chest pain, triggered by exercise or stress, relieved by rest or nitroglycerin. ECG often shows ST depression. Mechanism, exercise oxygen demand but narrowed arteries cannot increase supply. B, unstable angina, cause ruptured atherosclerotic plaque, platelet aggregation, partial thrombosis. Characteristics, occurs at rest, unpredictable, more severe, medical emergency, not always relieved by rest. Clinical importance, part of acute coronary syndrome ACS and may progress to myocardial infarction. #C Prinzmetal variant angina cause, coronary artery vasospasm. Characteristics, occurs at rest, often in younger patients, transient ST elevation, responds well to vasodilators. Best drugs, calcium channel blockers, nitrates. Number 3, organic nitrates examples, nitroglycerin, isosorbide mononitrate, isosorbide dinitrate. Clinical use, first line for acute angina attack, rapid relief of chest pain. Mechanism of action, step by step. Nitrate enters vascular smooth muscle, converted to nitric oxide, NO. NO activates guanylyl cyclase. Guanylyl cyclase increases cGMP. cGMP causes dephosphorylation of myosin light chains. Smooth muscle relaxes, blood vessels dilate. Hemodynamic effects, low dose, venodilation, venous return, preload, myocardial oxygen demand. Higher dose, arteriolar dilation, afterload, cardiac workload. Adverse effects, common nitrate side effects, headache, most common, facial flushing, postural hypotension, reflex tachycardia, dangerous drug interaction, nitrates plus sildenafil, Viagra, both increase cGMP, excessive vasodilation, severe hypotension. Patients must wait at least 5 to 6 hours between them. Number 4, beta-adrenergic blockers, used mainly for stable exertional angina and postmyocardial infarction protection. Mechanism, they block beta-1 receptors in the heart. Effects, heart rate, contractility, cardiac output, blood pressure. Result, reduced myocardial oxygen demand. Non-selective, propranolol, cardioselective, preferred, metoprolol, atenolol, isobutolol. Contraindications, avoid in asthma or COPD, especially non-selective drugs. Severe bradycardia, peripheral vascular disease. Important clinical warning, do not stop beta blockers abruptly. Sudden withdrawal, rebound sympathetic activity, severe angina or hypertension. Number 5, calcium channel blockers, CCBs. Mechanism, they block L-type calcium channels in vascular smooth muscle and myocardium. Result, calcium entry, vasodilation. 2 subclasses. A, dihydropyridines, examples, amlodipine, nifedipine effects, strong arterial vasodilation, minimal effect on cardiac conduction. Clinical use, stable angina, Prinzmetal angina. B, non-dihydropyridines, examples, verapamil, diltiazem. Effects, heart rate, AV conduction, contractility. Verapamil equals strongest cardiac effect. Adverse effects, common side effects, peripheral edema, headache, constipation, verapamil. Important warning, CCBs can worsen heart failure due to negative inotropic effects. Number 6, ranolazine, sodium channel blocker. A newer antianginal drug used when standard therapy is insufficient. Mechanism, blocks late sodium current, INA, in cardiac cells, reduces intracellular sodium, decreases calcium overload, improves myocardial relaxation, reduces oxygen consumption. Important advantage, does not significantly affect heart rate or blood pressure. Clinical use, used as add-on therapy for chronic stable angina when symptoms persist despite beta blockers, calcium channel blockers, nitrates. Adverse effects, QT interval prolongation, renal dysfunction. Drug interactions metabolized by CYP3A4. Important interaction, simvastatin. Number 7, key board exam takeaways. High-yield exam points, nitroglycerin, fastest relief of acute angina, beta blockers, first line for chronic stable angina, calcium channel blockers, best for Prinzmetal angina, ranolazine, add-on therapy for refractory angina, nitrates, sildenafil, severe hypotension. If you want, I can also create a simplified lecture